You're watching Bikasisa's Health Beat. I'm Mia Malan. We are 3 days away from our 7th general election since democracy. About 50 political parties are standing, giving us more choice than ever before, but not necessarily informed choice. During a recent Bikasisa webinar, we found out for you how some parties plan to bring good healthcare to everyone.
Hello and welcome to this Bikasisa elections webinar.
The national health insurance, it is going to obliterate that divide that is between the private sector and the public sector. And by so doing, we will have, instead of the two twin track system that we are having, there will be no difference between the private sector and the public sector, and all the facilities that will give everybody care, it will be done equitably and everybody will have access.
The NHI bill, while well intended, poses significant risk to our healthcare system. Instead, the DA advocates for universal access to healthcare through governance reform and collaboration with the private sector. We will lower private healthcare costs, enhance accountability, and ensure access to prescription medication. Removing political influences from appointments, we will ensure that every South African receives quality healthcare they deserve.
I support universal healthcare, but the fixing of primary healthcare has to be a priority. By that I mean, for me personally, I will work and I want to work on the Standing Committee on Public Accounts to see how every cent is spent at every level of the healthcare system and to assist movements. I'm not going to Parliament as an individual. I'm going as part of movements. The critical question for me would be how movements work together with health committees, with the Minister of Health, and so on. Our duty is first and foremost to assist good civil servants, good public servants, and our duty after that is to hold accountable those who don't do their jobs.
What will serve the country and the majority of the population of the country is to have one public health system. The NHI currently still relegates the Black people, the poor people, people in rural areas to the same fractured, fragile health system that is dysfunctional, because it still demands of them that they remain seeking help in those spaces which they occupy. We still have family members who cannot bring babies alive from a hospital because of a lack of cesarean sections, long waiting queues in hospitals. Even under this NHI that they think is a magic bullet, those conditions will not change because they are not doing systemic work that is required. They are still defunding the health system.
So outside where it's written president.
With the National Health Insurance Act now a reality, we asked HIV activist Yvette Raphael whether she has faith in its implementation.
Credit to the ANC, this is their thought, this is their idea. The NHI bill has been coming on for years, and I always say to people, I was part of the community advocates at the time who decided or spoke about and suggested some of the pilot hospitals in South Africa that were going to be part of it. However, the ANC keeps changing people. I don't think the current people in the ANC even understand what the NHI meant to those veterans who wanted the same health care for South Africans. A better option for us as South Africans is for us to really understand that our healthcare system is failed us. The ANC government has messed up the healthcare system. And I tell you, early 2000s, I was proud of being in a public sector. I gave birth to my daughter in a public healthcare system. However, when I think about what some people faced 5-6 years after that, it's just atrocious. one thing that I can say is that the public sector care for HIV is the best. The only problem there is the queues and the planning. But because of HIV activists and community, have we started to make plans to make healthcare better? For instance, people are able to pick up HIV medications for long months, up to 6 months, and that helps with the queues. However, I'm still worried about that. I'm still very worried about how people will access their services if somebody has to go to Netcare to go and pick up their ARVs there.